Hi everyone, I'm Patty, and welcome back to Beyond Bedside with Pati. If you've been researching utilization management nursing, you've probably heard terms like inpatient utilization management, prior authorization, and post-acute utilization management. And if you're anything like I was when I first learned about managed care nursing, you may be wondering what all those terms actually mean. The truth is that utilization management isn't just one job. There are several different specialty areas within utilization management, and today I'm going to explain the three major areas: inpatient utilization management, prior authorization nursing, and post-acute utilization management. Let's start with inpatient utilization management. Inpatient UM focuses on patients who have been admitted to the hospital. The UM nurse reviews clinical documentation to determine whether the admission meets medical necessity criteria and whether the level of care is appropriate. Inpatient UM nurses often perform admission reviews, concurrent reviews, observation reviews, and continued stay reviews. They work closely with physicians, hospital case managers, discharge planners, and healthcare teams. If you have a background in acute care, medical surgical nursing, ICU, telemetry, emergency nursing, or hospital case management, inpatient UM may feel very familiar because you're reviewing hospitalized patients and evaluating whether they meet criteria for inpatient services. Now let's talk about prior authorization nursing. Many nurses don't realize that prior authorization is actually a major area within outpatient utilization management. Unlike inpatient UM, where the patient is already in the hospital, prior authorization reviews often happen before a service is performed. Examples include advanced imaging like MRI and CT scans, surgical procedures, and specialty medications. Advanced imaging such as MRI and CT scans, surgical procedures, and specialty medications. Also infusion therapies, physical therapy, occupational therapy, speech therapy, and durable medical equipment. The nurse reviews clinical information and supporting documentation to determine whether the requested service meets medical necessity criteria. Many health plans and managed care organizations have large prior authorization departments because there are so many requests reviewed every day. If you enjoy reviewing guidelines working efficiently, inpatient UM may feel very familiar because you're reviewing hospitalized patients and evaluating whether they meet criteria for inpatient services. This role uses your critical thinking to its fullest. Now let's move on to post-acute utilization management. Post-acute UM focuses on care that occurs after a hospitalization. This can include skilled nursing facilities, inpatient rehabilitation facilities, and long-term acute care hospitals, and home health or durable medical equipment. Post-acute UM nurses review requests and clinical information to determine whether patients meet criteria for these services and whether the requested level of care is appropriate. As someone with a home health background, I can tell you that post-acute utilization management often requires understanding discharge planning, recovery expectations, functional status, and transitions of care. Many nurses with home health, rehabilitation, long-term care, case management, and discharge planning experience transition very well into post-acute UM. So which area is right for you? If you enjoy acute care and complex hospital cases, inpatient UM may be a good fit. If you enjoy reviewing requests, working with guidelines, and seeing a wide variety of cases, prior authorization nursing may be a good fit. If you enjoy discharge planning, care transitions, rehabilitation, home health, and post-hospital care, post-acute UM may be a good fit. The good news is that all three specialties use many of the same nursing skills. They all require several essential nursing skills: clinical judgment, critical thinking, and documentation review. Also communication skills, understanding of medical necessity, and strong nursing knowledge. Before we wrap up, let's do a quick recap of these three areas. Inpatient utilization management focuses on patients who are currently hospitalized. These nurses review admissions, concurrent stays, observation cases, and continued stay reviews to determine whether patients meet medical necessity criteria and whether the level of care is appropriate. If you enjoy acute care, hospital documentation, and complex clinical cases, inpatient UM may be a great fit. Prior authorization nursing, which is part of outpatient utilization management, focuses on reviewing services before they occur. This may include imaging studies, surgeries, specialty medications, therapies, infusions, and other outpatient services. If you enjoy working with clinical guidelines, reviewing a variety of cases, and making timely determinations, prior authorization nursing may be a great fit. Post-acute utilization management focuses on care after a hospitalization. This includes services such as skilled nursing facilities, inpatient rehabilitation, long-term acute care, home health, and durable medical equipment. If you enjoy discharge planning, transitions of care, rehabilitation, and helping patients continue their recovery after hospitalization, post-acute utilization management may be a great fit. The important thing to remember is that all three specialties use your nursing knowledge, critical thinking skills, and clinical judgment. They're simply applied in different settings and at different points along the patient's healthcare journey. One thing I think nurses don't realize is how many opportunities exist within utilization management. When people hear the term nurse, they often think it's one specific role. In reality, there are multiple specialties, multiple work settings, and multiple career paths within utilization management. That's one of the reasons I enjoy this area of nursing. There's room to grow, specialize, and find the type of work that best fits your interests and strengths. I'd love to hear from you. What are your thoughts on this nursing field? Which area sounds most interesting to you? Inpatient prior authorization nursing, or post-acute utilization management? Let me know in the comments below. I check them regularly and love to chat. If you found this video helpful, please like and subscribe. Thanks for watching, and I'll see you in the next video. Goodbye.